My name is Peggy Kincaid, and I'm a psychotherapist, a licensed marriage and family therapist. For a lot of diabetic patients, the challenge is that they're overweight and that they need to lose weight and change the way they eat. And that's often pretty difficult for people. They're given something else besides a diet, some other way of relating to food so that they can actually keep to the diet that they need to. The thing that's the most important about conscious eating is that if you eat consciously, you eat less. And sometimes people think it's the opposite. Well, if I really pay attention, I'll eat more. But no, it's the opposite. They're not really having an eating experience. They're sort of missing the eating experience. They've stopped tasting food. They've stopped being conscious and aware. So when you introduce some awareness practices and you get people to really pay attention while they're eating, what that does is it has them eat less. And their own body wisdom tells them to eat less, not a diet. So you're really empowering people to start to make their own decisions and to become a little more friendly with their own bodies. Well, I think if you begin to eat consciously, it means that you've started to relax, you've started to quiet your mind, you started to pay attention a little bit more. So if you're eating consciously, chances are you're starting to live a little bit more consciously. And if you live more embodied, if you live paying attention to yourself more with a quieter mind, that improves the quality of your life. A diabetic person making healthier choices, a lot of that means they're not choosing to eat refined carbohydrates, which affect their blood sugar. So if they're not choosing refined carbohydrates, then they're starting to even out their emotions and their moods. That's one of the most significant things. One of the most important things is they start to feel hopeful that they actually can change their relationship with food and make healthier choices, and it doesn't have to feel like a punishment or deprivation, that they found another way of relating to food so that it's something they can live with. It's not just a diet that they go on and off, and that they've made a little deeper connection to themselves. They've touched into their own body wisdom. They're listening to their body, in a way making better friends with their body. So happier, more content. A week like this of a retreat, people do get to kind of sample a lot of different practitioners and see what does work the best for each person. It's starting to try and work with them in a way that's not about their fear, but about what they want for themselves.